Good morning, everyone. This is Beth Skinner. I'm the statewide recidivist reduction coordinator. Welcome to preparing for a study of probation parole officers' workloads in Iowa. Today, I'm happy to introduce our presenters today, Director Jerry Bartriff, Dee Bell from APPA, she's a consultant with APPA, and Dr. Nathan Lowe, who is also a researcher with APPA. But before we get going, I have a few housekeeping things to go over. You all should be on mute, and so what we'd like you to do if you have questions is to use the chat box for questions, and what we'll do is at the end of the presentation, Nathan and Dee will answer those questions that you have throughout the presentation. But next, briefly, I would like to talk about what statewide recidivist reduction strategy is for those of you that may not have that information. The SRR is the Governor's Office of Drug Control Policy and the Iowa Department of Corrections are recipients of a $3 million grant over 3 years from the U.S. Department of Justice. And this is to support implementation strategies to reduce statewide recidivism of adult offenders. The IDOC has identified several focus areas for the grant initiative in order to reduce recidivism, including engaging interagency steering committee, comprehensive system-wide quality assurance plan, statewide training plan, enhancement of reentry policy and practice, statewide job competencies, and what we're all talking about today, developing an evidence-based workloads. This effort is a state-level interagency collaboration among multiple state agencies that will require cooperation and commitment to achieve the same goals, which is reducing recidivism and victimization. So now I'd like to turn it over to Director Bartriff for his comments.
Thanks, Beth, and good morning, everyone. I'm very proud of the work that we do in the Iowa corrections system. Nationally, we're known as a leader in the country and around innovation and best practices. The workload study we will be talking about today demonstrates our innovation and willingness to break new ground. We recently completed a workload study on prison counselors, the first such study of that workforce in the United States or internationally. One of our main strategies with the SRR is to utilize the resources we have in the most efficient and effective manner. Additionally, we not only want to deploy our resources, our staff resources more efficiently, we want to potentially demonstrate a need for more staff in a quantifiable way, as well as maintain the existing staff through a workload study. Through this workload study, policymakers will have a better understanding of the work done in CBC and may be more inclined to maintain or fund new positions. A workload formula moves us in the better direction of understanding the day-to-day tasks, times required for such tasks, and how best to target our time on practices that impact recidivism reduction. A time study will give CBC staff credit for the important work they do, as well as provide supervisors and administrators with the formula to base workload decisions upon. I appreciate your willingness to participate in this work that will inform us in the best use of our most important resources, our staff. A special thanks to the advisory committee for their work on this project, and thanks to all of you for your support and participation. I'd like to now turn over the presentation to Dee Bell. Dee?
Good morning, and thank you, Director. So I'm glad you guys are all on the call. This is important work. I think most of you know what the American Probation Parole Association is, but we are the national association that represents all of us in this profession. And on your screen you can see our vision for a fair, just, and safe society where community partnerships are restoring hope and embracing a balance of prevention, intervention, and advocacy, as well as our mission. And as you could guess, this lines up very well with reentry efforts and what we all are doing daily in the community. Okay, Nathan. Just to sort of bring you guys up to where we are, we've been actually working on this project since early March, and we've been through a number of steps that you can see outlined here, and you see that we have a number of checks all through March through August, and here we are in September, and we're doing the webinar, and it's to prepare all of you to begin doing the time study, and that's our next step. So why would we do this? And I think the director just sort of outlined that, but it's why is it needed, how will it benefit your organization, and how can it benefit you individually? So here's the goals. It's first to organize, define, document, and quantify agency functions objectively. So what is it that CBC staff do, and when do they do it? How much of it do they do it? Should they do more or less of each individual activity? And at the outcome, we should be able to know where should agencies' resources be redeployed or increased to meet the mission of the department. Okay. So resource allocation. One of the things that happens over time is population moves within a state. Population can grow, and especially as we move towards reinvestment, and the work we do can change as we move towards core correctional and evidence-based practice. So one of the things we've got to look at in this time study is what are people doing, and do we have enough resources devoted to meet that goal? Okay. Budget justification. Every year, the director and others probably go across to your legislature and the governor and talk about what is needed to meet the mission of the agency and what new resources may be required and how to justify the budget we currently or you currently have. Having this real clear understanding of what the workload is and what it takes to meet the mission is part of how you justify your budget and, if necessary, ask for increases. Okay. And then organizational accountability. One of the things that we all struggle with is this idea of we know what we're trying to do, but are we really doing it? And are we really doing it in the most appropriate and the most sustainable fashion? So by doing a time study, we can take a snapshot over this 4-week period of what people are acting day to day, who's involved in which task, how long each task takes, and then line that up against meeting the goals of the agency. Okay, Nathan. So a quick way of looking at it, for some of us it's always easier to look at a picture than it is to think through the process, is you're looking at better management, an increased knowledge of the operation of what we actually do, and a better allocation of the resources. When we line those three things up, you get increased efficiency. You can do things in a better way more quickly, and that will lead to an increased effectiveness. This is particularly important at this time as you guys are moving more and more to core correctional competencies and to evidence-based practice. Okay. So one of the things you always do when you begin a project is you go back and see, has it been done before, and who did it, and what did they learn? So here's our answer to that. Okay, Nathan. So this, one of the good things for us doing this project is that there's been a number of very good time studies done on probation and parole work over time. And a number of those have been done across the country, but also have been looked at sort of as an aggregate so that we could come to some understanding of how much time it takes to do what component of jobs. BJA as well as APPA have been involved in a number of these studies. Okay. So here's just a map to show you some of the examples of where recent ones have been done. Actually, the studies go back about 30 years in our profession, so there's a wealth of information to draw on. You guys will be the latest and the greatest, I'm sure, when we finish this study. In general, these studies can last from 4 to 8 weeks on average, with the standard being about 4 weeks or a month, and that's what we're aiming for. It takes about 20 minutes a day to actually track what you've been doing in a day's time, and we're going to go through how we're going to do this in Iowa. It'll all be done electronically on the computer. Okay, so how to participate. And you're going to pick up here, Nate?
Yes, that's right. Thanks, Steve.
Okay, this is Nathan.
I'm Nathan Lowe, everybody. I'm a researcher, as Beth mentioned, with APP. I'm going to be leading the research efforts here and ensuring that everything runs as smoothly as possible. Just a few things to note is that if you have a question at any point during the presentation here, maybe a technical question, that's fine. In the chat box, I'm not sure if Beth mentioned this or not, but if she did, I'm sorry. But you can enter that question at the chat box at the end of the presentation here. We'll address any of those questions. And then, of course, we'll provide you with additional contacts should you have any questions in the coming weeks once we actually start the study. So at this point, what we're going to walk you through is kind of how do you enter an activity. Essentially, how do you record the time in which you dedicate to an activity, and where to access that, all the options that are available to you. So we're going to try to walk you through that to make it as simple as possible. And of course, I'll let Mark come in and chat. Mark, don't hesitate to come in and chat since you orchestrated and developed this online. But I believe you'll be accessing the DOC portal on SharePoint to be able to, so that's where you'll start to actually enter that activity. I should say the form has been integrated into your online database system, so you should be able to easily access it. And then from there, you'll click Other on your options that are available on the portal. And then from there, you'll select DOC Web Apps in the drop-down menu. And then within those, once you click on that, you'll have a number of options available to you. At the very bottom, in the allowed databases, there will be the SRR time study. There'll be a link for that. You click. And then this brings you to really the form itself. And so as a staff member, the first thing that you will do is describe and provide information about yourself. And so you'll see here at the beginning, everyone will receive a unique study ID. We'll email those to you. And again, those are unique to each individual who participates. So please do not share your ID with anyone. It's a way for us to keep the information anonymous, so in a bit of the blinded to reduce the number of bias. And so we're able to just really track it, this unique study ID rather than individuals themselves. And then from there, you'll institute, of course, this is institution, but it should say district, so you'll identify your district. There'll be a drop-down menu. Most of the form involves drop-down menus in which you'll select an option. And then you can see the demographics in which you'll select. The next thing is really I want to bring to your attention is the date in which you started working for the Department of Corrections there in Iowa. So that would be indicated as your hire date. And then from there, it's your job start. So specifically, when did you become working as a CBC staff member within the department, of course, within your district as well. And then there will always be, a text paragraph, a box for you to be able to type in additional notes that you'd like to provide about yourself and the information. And of course, then you'll hit Save Update. That'll then bring into you the activity summary page in itself. And so here you have a number of options. Of course, at first, the top left, you'll see where you have actually that the information that you just entered for yourself is being recorded, as well as the additional notes. So on this screen, you're allowed to, it'll show you all the activities that entered for that specific day, right? And so you can certainly change this. So it'll be, see there's the calendar icon in which you can click to see what activities you completed for which day, and shift left to right to be able to go from one day to the next. And so, this is your summary page, and so this is going to be showing you all of the activities that you've entered for that particular day, each day's all together during the course of the study. During which time you'll be able to see for each row there is the activity recorded. And we'll show you in a moment actually the different options of how you actually enter the information for each activity. But should you complete an activity, of course we'll talk about this in a moment, we encourage you to record activity soon after completion, as soon as possible. So maybe you set aside so many, a time slot per day, you're able to track the different activities, but the sooner the better, and it allows for more accurate and complete information and as in real time as possible. That's certainly going to be. But should you, for example, complete an activity, record that information, enter it into the database here, and then want to go back and edit it for a past activity, you'll have that option available to you. here. Okay. And then, of course, there's an option there. So, again, you pull up, you start it, you've entered a few activities for that day, you go back into the database, and it's time to enter a new activity, information for a new activity. You'll add that there at the bottom where it says Add Entry. Now, for the activities themselves, we have a lot of information here with respect to how to record that, but we've gone through a fairly lengthy process over the last several months. I'm working with committee members and other staff there at DOC and able to first identify all the different activities that CBC staff perform. And I think our list is about 66, 67 unique activities that you perform, okay? And so then we figured out a way to categorize those activities, whether there needs to be, okay, the method of contact, what persons were involved, of course, which offender, and you're going to identify the offender by his or her ID, and then, of course, where the activity occurred, the place, and then any additional, for example, if you select one activity and there's kind of sub-activities associated with it, you'll have those be able to, so that's the, and then, of course, the time associated with it, how much time you spent on that, what was the outcome, did you complete it, did you need more time, did you make a referral, did you feel like you had adequate time to complete the activity, and then we'll give you a couple options there. So I'm just kind of giving you the big picture now. Now we're going to walk you through each of these different options on this particular form. Okay, as I mentioned a moment ago, if the activity is associated with a specific offender, you'll enter the correct ID at that box there. And you can, of course, you can also search offenders by their ID as well. And then we'll show you in a moment the method, place, activity. We'll show you all the different options in there, but each of those are drop-down menus. So you simply click on the arrow there that's pointing down, select the appropriate option that's for that particular activity, and proceed from there. Again, as I mentioned a moment ago, should there be a need for you to provide additional information about a particular activity, or if you need to provide some clarification just on the activity, there is this text box in which you can do that, okay? And then again, just bring your attention, you'll actually record in minutes. See, there's three different time, I guess, elements that we've associated with the activity. So was there any travel involved? For example, if you attended a training outside of your district, or maybe within your district, but it was in a different office that you had to travel, you and your colleagues, you would record in minutes how long it took you. If there was actually any waiting, any downtime, for example, if you had to go to court, you had to wait for a period of time, you would record that there. And then the time spent in conducting the activity itself. And again, these are all minutes, but you'll actually enter those specific numbers for each of those three time variables. And then again, as I mentioned a moment ago, there's the outcome, adequate time, and various, which we're actually going to be calling challenges in a slew of different challenges. So if you felt like there is some type of challenge that, yes, you did complete the activity, but you felt like you needed more time to complete it, and then you can also identify, well, what were the challenges that were presented to you that maybe kept you from being able to feel like you had enough adequate time to complete that particular activity. So again, those are optional, but we certainly encourage you. It allows us, as well as DOC, as in the entirety of the project, to get a clear, thorough understanding of the time spent on activities, the amount of time, if you felt it was adequate, and what challenges are presented to you on a daily basis in completing these activities. So adjustments can be made, as Dee mentioned a moment ago, which is an underlying purpose of a study like this. And then, of course, you want to save the activity, save and create new. And another option is save and create new with this information, meaning that if you have multiple activities to report, let's say, for example, in the last hour, you performed 4 different activities for the same offender, where you're able to actually, instead of having to enter all the offender's information again, in your information again, from here you're able to just go from recording and saving the information from one activity to the second activity to the third, etc. So hopefully it helps you reduce the amount of time spent in recording the information spent or that dedicated to actually completing the workload. Okay. Now let's kind of work through the different codes of what's on this form that I just showed you that's presented within the drop-down menus if you select them. So the person code. So these are all the different types of people that could be involved in an activity, right? And note that some of these actually we provide, okay, so by group, for example, number 4, a group setting, group treatment in which you're working with multiple offenders in those particular settings. Staff, number 10, certainly your colleagues within the office, other colleagues that may be within your district that you're involved with the training, communication that you may have with the other Department of Corrections staff members and colleagues. Certainly your supervisor is specifically a person, so note that that's different than just staff. The offender, his or herself, the offendant's guardian or family, treatment provider, victim's family. And then, of course, we try to be as exhaustive as possible in identifying all the potential options for each of these particular these data elements. But should you feel like there wasn't an appropriate person code for this, there's always an other that you can select and specifically identify the answer for this particular. And if you know, for each of these also, if it's not applicable, you can always pick none or not applicable. That will be an option for you as well. Method. So the method in which the activity occurred. So for example, you met with the offender face-to-face in your office. Well, the place would certainly be in your office. The person would be the offender, and the method in this case would be face-to-face. Phone, voicemail, so phone could involve whether you're using a cell phone, office phone, landline phone. So we've combined those into just one type of method. Number 6, pay attention to that, virtual. So if you have some type of virtual, online interface with or interaction with someone, I was specifically told by your colleagues that maybe Skype is an option that you all use to virtually connect with other people. So you would identify that there. And that would be different than computer. For example, what we're specifically talking about here is a computer software program in which that's where the method occurs. Okay. And again, other, that's an option for you should there need to be clarification or a particular method you feel is not clearly identified in the drop-down menu that you can select. Place, this is pretty straightforward, all the different places in which the activities can occur. And you can see there, nothing too, it's all straightforward, different options there. Okay. So, and you'll note that we have, for offenders, if we're looking at the place for, as it relates to offenders, his or her home, furlough location, and work site. So we've been very specific in identifying each of those 3 distinct places that an activity can occur. And then, of course, field, out in the field. If an activity occurs in the field while you're, you would identify it there. Okay. Now, the next 2 slides cover all the different activities in which you can select. And what I'll do before and actually the study commences is I will put together what I'm going to call some type of user's guide. It'll be a document that each of you can have to reference any particular activities, all this information. Of course, this webinar will also be recorded. Should you want to go back and re-listen to it, you can do that. But you'll also have a document that you can help as you reference any of these activities to make sure that what you're performing, the activity you perform, you want to be able to document correctly. But all of these, again, we spent a long time with this. We started with activities, and we've reduced them to about 66 or so. And so Some activities may correspond to different points of contact that you have with the justice system, that an offender has with the justice system, that you may be involved with him or her. For example, an activity that occurs during pretrial or the PSI stage may be different than during active supervision, individuals on probation. The same activity may occur, but we've been able to specify them separately. Okay. Now, in contact, I want to bring that one to your attention, number 12. So what that means is if you have any type of contact with a person, so that's your activity. You have a phone call, that's the activity. You identify, you select contact as your activity, and then the person in which you had the phone call with, or the method, is the phone call. Okay, so I suspect that that one will be utilized quite a bit, given that that's probably the majority of your job. This is at least what I suspect. Okay. So this identifies 32 unique activities. Okay. And then 67 total. So these are the other activities that you're going to, personnel, for example, number 38 there. If you take any type of leave, or you're taking time to complete your timesheet or complete any type of personnel forms, that's activity that you'll select there. Okay. We have some that are specific to specialized offenders. For example, number 54, sex offender registration. So if you're working with that offender type, then you're dealing with that processed activity. That's where you document that. 56, time study documentation. So something that we're also going to be paying attention to and asking you to do during the full weeks of the time study takes place is to actually record the amount of time that you spend on documenting what you're doing here, because that is something that we're going to use as kind of a to really get a sense of how much time you all spent in completing the study, as well as being able to control for that. And once we administration staff make decisions, take the information from the study, and then make decisions of what potential changes need to be made, we'll also consider the amount of time spent on that you documented that as kind of as a control variable. Okay. So those are, and so once you select activity, you'll have the drop-down menu, and this will be the 67 different activities that you can select from. Okay. Now, going back, so let's say, for example, you select assessments and screening as the activity. You're conducting an assessment with an offender. The next thing you'll do is that you'll have, this will be listed as a sub-activity, right? And then you'll be able to identify the specific instrument that you use to you administered with the offender. Okay. And although again, I'm pretty sure we were pretty exhaustive in all the different types of instruments that you would be using, there is an other there, so you can always type in what the instrument that you used. Another sub-activity that you would be able to select is that if you made an entry into your database system, right? So the database system is data entry is listed as a specific activity, and then you can identify the type of data entry that you make. So if it was a new case, generic notes, etc. Okay. So again, this would be another sub-activity that you can select from. And then the final sub-activity in Center is the transfer. So if you identify, if you selected in the activity drop-down list some type of transfer of the offender, right? And this does not include interstate compact, because you'll note that interstate compact is listed as a separate activity in itself. But if we're talking transfer of the offender, for example, as you can see here, from DOC Institute to the field, within office, so if you are transferring a case to another colleague within your office, or within the state from another, so offenders moving from one district to the next, for example, or within the residential treatment center. And let me reiterate that this does not include interstate compact cases. That is listed as a separate activity in itself. Okay. Now, so that gets us beyond the different activities that you can select. Again, 67 unique activities, and then there's 3 different sub-activities that you can select from. And then the next thing that you'll do is that you'll note the outcome. Again, if you go back to that form, at the bottom of that form, you'll be able to select the drop-down menu to identify the outcome. So it's pretty simple. Did you complete the activity? Did you feel like you need to dedicate more work to be able to complete the activity? Or did you make a referral for that particular case, maybe to a treatment provider? But that was the particular outcome. Okay. And then it allows you to identify whether you had adequate time to complete the activity, right? And so something that we learned from the counselor's study, the correctional counselor's study, is that they felt a little bit limited. It was either really no or yes. Well, yes, you may be able to complete the study, but maybe you felt like you needed more time to do it. So to avoid that ambiguity, we allowed a third option here. We had a third option for you guys, and that is, so you'll select no, did not have an adequate time, so to be able to complete this activity, yes, but you feel like you needed more time to be able to do it, or yes, you had enough time to be able to complete the activity. So you use your own discretion to determine whether you had adequate time or not. Okay. And then from there, again, on the form, then you record the number of minutes that you spent traveling, waiting, and then actually completing the activity, right? And then the last thing you'll identify are whether any challenges that were presented in you to be able to, that maybe kept you from completing the activity in a specific amount of time, or maybe caused you to identify, for example, that you needed more time to complete an activity. And so again, we try to be exhaustive with this list. So maybe it was a task that you just quit, you abandoned it, you felt burnt out, the client or the offender was being uncooperative, that caused you to have to be able to spend more time and be able to complete the activity. You've had some difficulties with your colleagues, your co-workers. There's some type of cultural misunderstanding between you and a client, you and a colleague, or other type of third parties that may be involved. Of course, excessive caseload can be identified as a specific challenge in completing activities, and et cetera. You can see the different ones: paperwork, technology, policy was unclear to you. So again, using your own discretion to be able to identify what challenges, and you can do this for each activity that you record. So we certainly encourage you to be able to spend some time identifying if you felt like a challenge prevented you to be able to complete an activity in a timely fashion, then please identify. And of course, there's always other. So if you didn't feel like the challenge was listed here, you can type it in using the other option. Okay. So again, walking you through the form, we try to simplify it and make it as easy as possible. There are a lot of activities, but what we try to do again is to be able to be exhaustive with those activities and allow there's just a few sub-activities and simplify the different response options that you can select. Okay. And again, just a few things to remember. Enter data actively. So at least on a daily basis, we will be able to conduct checks during the course of the study, and making sure that everyone's completing the activities in a timely fashion. So I would simply encourage you to maybe talk with your colleagues, your office staff, as far as maybe come up with a plan as far as how you plan to document your time during the course of the study. Okay. And as I mentioned throughout the presentation here, if an activity occurs that's not listed, please select other and provide as much information as clear, as concise as possible to describe the activity. That helps us and informs us. And also, as I mentioned, the time study will commence on September 26th, so in roughly just a few weeks, and it will last for approximately 4 weeks. So it'll be which is for Friday, October 21st. September 26th is on a Monday. So for during those 4 weeks, that is when in which you will be completing. Now this is pretty standard for time studies. You can't ask folks to be able to much more than that, because there is a bit of time that you all have to dedicate to be able to participate in the study. So that's a pretty standard length of time that is used in research. Okay. And then something else that we'll do is about a month or so after the time study data collection is completed, we'll send you a brief web-based survey. And so where the time study, so the time that you're documenting and completing activities, that allows us to get a sense of the actual time that you spend on completing those activities. This survey specifically will provide additional opportunities for input on specific tasks that you feel needed more time. So this is, again, it's going to be brief, take you no longer than 30 minutes. We're going to send it to each person who participates in the time study, and it's, again, providing us with additional information and insight that we can gain on just really specific tasks associated with the time that you spend. Okay. And just a reminder kind of what we're doing with this project. I know Beth mentioned that early on. The director made a few comments, and then of course Dee mentioned kind of giving you the overall purpose. But what we're trying to do here is accurately document and represent the work that you do. It's really important that these are studies that have been done before, and so from a research standpoint, we've got a really good handle, and we can compare what you're all doing there in Iowa to what other states, what other officers, supervision officers are doing in other states and other local jurisdictions. But it's good representation of the work that you do on a daily, weekly, and of course monthly basis with different types of offenders. We'll also get a sense of the different types offenders that you're supervising, to see if your workload and the time that you spend on activities is specific. Does it matter? I mean, someone with that just has a sex offender caseload, or a mental health, you're involved in the mental health, or involved in any type of specialty courts, and those types of programs that deal with specific types of offenders, or you have offenders that are kind of on dual supervision. So all of these different kind of nuances are going to be tracked to some extent behind the scenes, and then allow us to give a better picture of again, representing the work that you do. Results may be used to justify requests for additional staffing. For example, district to district, we'll be able to compare that, looking at the differences between districts, and also to see if if it's the staffing requests are justified or not based upon the time spent on completing activities, etc. And of course, reallocation of resources, adjustments of task assignments, things that Dee mentioned a moment ago. We'll be specifically looking at aggregate data and collective trends, not individual practices, which again also is why we're not going to be asking for your names, and instead giving you a study ID. So, for example, we can't go back and say, well, John Doe over here did all of these different activities, and we're not going to be providing that information to your supervisors. But again, everybody's going to be we're looking at the aggregate, the collective nature of the work that you all do. Okay, so of course, if you have any questions over anything that we've discussed up to this point during this webinar, this is a good time to ask those questions, and we'll check out the chat box here.
Nathan, this is Dee. We've got one thing that Beth is needing. We need to know we need to know who's actually on the call. So she suggested we do a verbal roll call where people just tell us who's there.
Okay.
So
should we do that now, or wait till before we end?
Just by district?
Like that.
Oh, you just need the district. What districts are on?
Yes.
So like, is anyone from District 1 there? Like that.
okay, so you want to call the districts. How about you call them, and I'll write down as they say their names. How about that?
Do you want
How about we start with District 1?
It's just anyone here from District 1.
No, they're
If you're on from District 1, they probably can't speak because they're muted. Go to the chat box and list everybody from your district and tell us what district that is.
Hey Dee, I think the best idea, because that might be kind of cumbersome if there's a lot of people in the room.
Yeah.
How about we just? I think the best way would be is just if the district, whatever district is listening, just to put in the chat box District 1. We don't need to know the specific names of people.
Okay.
And District 2. That's probably the easiest way. Yep.
Okay.
Okay, so again, just indicate your district if you're on and you've been participating in the chat box. And then while people are doing that, there are a few, I think, content-related questions here.
Okay.
From some of the audience members. One question says, in case where you are talking with treatment provider and talking about multiple offenders, do you log each individual offender and time spent on them or the group as a whole? That's a great question, and certainly I think in that case, if it's the amount of you're conducting, really the group activity option is if you're actually conducting the group work yourself and you have multiple offenders in the same room. But if you're actually consulting with a treatment provider, then I think it's important for you to be able to document the activity for each individual offender if you're consulting with a treatment provider. Next question is when the results of the time study will be made available. And so kind of going back to our timeline, will be done, so it'll be 4 weeks, mid-October there. We'll spend about a month combing through the data, collecting the data, and then after that we'll have the survey. So we're hoping probably by December to be able to have some preliminary results available. We'll funnel those through Beth in her office, and she'll kind of be in charge of next steps from there. Does that sound right, Beth?
Yes, that's correct. Thank you.
Okay. Next question, are you expecting that this be done chronologically or as a summary exercise at the end of the day? So obviously, I think it's best to be able to organize, as long as there's consistency with how you're entering and documenting the data. Ideally, it would be chronologically, in which you're able to document in your own way from the beginning of your day to the end, in which activities are completed, and then you can complete that in a timely fashion. You set a certain amount of time at each day to be able to complete it. What we don't want is for you to be able to go 2, 3, multiple days where you're completing activities and you're kind of generally taking notes on documentation and then going back on day 4 or 5 and trying to enter all those activities. And I don't know if Beth or Dee wants to speak to this at all, but
well, some of the things people have done in other time studies is give themselves a few minutes before lunch and again at the close of the day to document either what they did in the morning or did in the afternoon. Some other folks have been able to do it where they just document each day at the end of the day. What we know is if you don't document every day, some of the details will be lost and we won't have as good a data set to represent what you did get accomplished in that day. I will say that one other group that I'm aware of kind of did keep a piece of paper where they made notes to who they saw and what they did, and then at the end of each day they went in and entered it in the computer. So you can find your own way, but don't let too much time go by or you will in fact forget some things that you should get credit for having done.
Good deal. And okay, I believe looks like everybody has noted their attendance. But that is all the
Question?
okay. When logging in, does it stay logged in all day, or does it log out after a certain time? I think I'll let Mark handle that one, or Beth internally. How does that? How does that? What's the? How does that work? Beth, do you have a sense of that?
Or Jennifer or Laura?
We'll have to get the answer from Mark, and
Okay.
not sure Mark's on the phone right now, but we can get that answer from him. He'd be the best one to answer that.
Okay. We'll get that back out to folks then.
All right. Here are a few other questions. I wanted to know about the anonymity of the survey process, given that the hire date is tied to a study ID. Yeah, I mean, yes, it's going to be completely confidential. Certainly, we will know the study IDs, but nobody else. Like, for example, your supervisors, DOC staff, they will not know. We'll be able to assign those study IDs to each unique person. So I can assure you that your confidentiality and anonymity will be protected. And that's the purpose of conducting the research. So you'll be able to provide as honest and complete information, and you know, kind of provide your voice in the survey format without any risk involved.
Hey, Adam, or Nathan. Geez, I'll never get that out of my head. One quick thing that we were talking about here is having access to the recording. And how will they get access to that? Because I think some people, it appears in the 5th District, are having some technical issues, and we want to make sure that they are able to get a recording of this presentation.
Okay, yeah, we will, once of course I'm recording it now, once I'll stop that, make it a few edits, and I'll send that file to you. Should it be too large, I'll find a way to be able to get it to you so you can disseminate it. We may be able to maybe even host it on your all's website so anybody can access it. So we can discuss that, yeah. A few other questions here, I'm sorry. Let's see, chronicle question. Are you working on a case and then you get interrupted? Okay, so you indicate that it's not enough time as an example, even though you may come back and finish it once a question. Okay, yeah, so that's what you would do. You may get interrupted, and that could also be, you can indicate you know, that as a challenge too, is if you're interrupted and trying to complete an activity for various reasons, you would indicate that not enough time completed. You can go back and then complete it at that point once the interruption is concluded. So I'm sorry I misunderstood you earlier. Will time be given? Will be given proficiently to prior to the beginning of the study?
They may be asking when will they get notice as a reminder. You will get reminders,
yeah,
you know, as we get closer, and as well as we'll probably open the study for a day or two ahead of time, and we'll notice you of that so that you can go in and try it out. And any information you enter in that tryout period will be dumped or will be deleted before we begin the actual study. But that'll give you a chance to go in and play with it and see how it works so that when you get to September 26th, you're prepared to go.
Okay, thank you, Dee.
Hope that helps.
There's a question about whether there's an activity for pre-parole work. Jennifer or Laura, do you want to maybe address that? Because of course we would have to discuss kind of offline what is involved with pre-parole work and whether that type of work can be included as in another type of activity.
Thanks, Nathan. So I'm passing over here to Jennifer and Laura.
This is Jennifer. We were going to have some probation parole officers pilot the time study database, and in doing so, They might give some of that feedback, but we'll take that already, the pre-parole stuff, and look at adding it to the activity list. So we appreciate that.
Excellent. Okay. Another question is a drop-down menu for vacation. Yes, that would be listed under the personnel activity. So any type of leave that you take, whether it's sick leave, personal leave, vacation leave, you would document it under that specific activity. Question from the 5th district staff. How will we know if we have answered all questions that are asked of us? Will we be prompted to answer, provide more information? I'm just, go ahead, Dee.
I don't think so. I think the answer there is no. You're going to fill out this form on each activity as completely as you can. It doesn't have the knowledge to know if you've left something out. So it's really, and it's important that you try to fill it out as completely as possible for each activity.
Yeah. Good deal. And then the few questions about access to the PowerPoint, certainly we can make that available to you. I'll also provide more information descriptions for each of the activities and a guide. I'll get that sent out soon within the week or during the time in which Jennifer just mentioned that it's going to be tested by some select number of officers. And then, of course, the recording of this webinar will be available as well. So we're going to try to make as many resources available to you. So there's what you have to do is crystal clear. Okay, a few other questions just popped up here. Is there a pretrial option? Pretrial specific activity, I don't think so, but what we did do is identify activities that would fall under pretrial and make those unique, if I recall. But again, that's something, as Jennifer mentioned, that can be documented during the testing to see if there's a need to identify a specific activity for pretrial.
Okay, I'll list that. I'm making a list of these as well, Nathan, so that we don't drop them. Okay.
Hey, Nathan, hang on one sec. Jennifer has a response to that.
Well,
okay, go ahead.
Behind the scenes, when you type in the offender code, we're going to pull that information that offender is on pretrial, or he's on probation, or he's on parole. So there's a bunch of stuff behind the scenes we're going to be capturing and giving to APPA as well.
So, which means you don't have to document it because we will be able to access the information.
So if you're typing a generic note for an offender that's on pretrial, we're going to capture that you did a generic note for pretrial offender.
Perfect.
Okay. Question about what's the purpose of CBC staff members providing their demographics, like gender, race, date of birth. That's certainly just we kind of routinely collect demographics, any type of research study. So that's just providing us with a picture of those type of that type of information across the entire state and all districts. So that would be the underlying purpose of that. Question about kind of assume that there's options for ICON data entry and then another for pre-sentence investigation. Am I correct to assume that the pre-sentence investigation option is for ICON data entry related to PSIs? Jennifer, you'd like to take that one?
Nathan, can you repeat the question again? Because we can't see it here.
Okay, the question is, I noticed an option for ICON data entry, then another option for pre-sentence investigation. Am I correct to assume that the pre-sentence investigation option is for ICON data entry related to PSIs?
Correct.
Yes, you're correct to assume that. Does this coincide with our ICON data entries, or are we duplicating our work? Was another question.
It would
So-
seem to me that there will be some matching in that if you've gone in and entered a case note on an offender in ICON, certainly you're also going to have entered into the time study that you met with ex-offender and it took this amount of time. But the time study is going to gather information that is not available in ICON. So we can't just pull everything out from ICON. That's the reason we need to do the study.
All right. That is the last question that I've received that I see here. Are there any other questions that we can address now? If not, of course, you have Jennifer and Laura's contact information on the slide in front of you. And kind of what the process will be after this. I'm sorry?
I was just going to say, and they can forward questions to us as well, Nathan, Jennifer and Laura.
That's right. So any questions you have, Jennifer and Laura, they're pretty good. So they'll probably know the answer to most every question, if not all the questions that you have. And so if not, should they need our guidance, they can forward to us, as Dee just mentioned, and we'll provide an appropriate answer. Okay. Well, thank you for your attendance, and thank you for allowing us to be part of this this very exciting project, and we're looking forward to the next coming months and getting information from you guys and being as helpful as we can for you to be able to participate and complete your activities, document the information. So, Beth, did you have any concluding remarks you'd like to make before we end the session?
I'd just like to say thank you, Nathan and Dee and Director Bartriff and all of you that are on the call today. We really appreciate your participation and your willingness to work with us in this time study. We're really excited about the results and what we can do with that information. So again, thank you. I know it takes a lot of time out of your busy days, and we really, really sincerely appreciate that. So thank you all very much. Appreciate it.
Have a good afternoon. Bye-bye.
Okay, that concludes the session. Thank you very much.